Hi, I'm Kathy Gallin, Legislative Lady for Signature Healthcare. In this series, we invite lawmakers into our facilities to see how the policies that they enact affect the lives of the residents that we care for. In today's episode, we interviewed Senator Rene Garcia from Florida. Senator Garcia has been a champion for healthcare policy and long-term care issues. He visited our Waterford facility in Hialeah Gardens. Take a look at the interview. Good afternoon, Senator Garcia. Thank you so much for joining us here today at our wonderful Hall of Fame event at Waterford. We know that you're very vested in the community and that you have great interest in healthcare issues, as you have proven to us as our senator in Tallahassee. I have a few questions for you today, and if you wouldn't mind, one of the first things that really comes to mind is in 2011, nursing homes in Florida received a 6.5% cut to Medicaid, which actually equaled about $187 million, which is an average loss of about $290,000 per facility. And that, in conjunction with the 11% cuts that CMS just handed down on the federal level, are affecting our industry greatly. 80% of the Florida residents here rely on Medicare and Medicaid for long-term care. And of course, 70% of operating costs in nursing homes are labor-intensified. Will you seriously consider addressing with your constituents and with your fellow senators taking on the restoration of state Medicaid dollars so that we can continue to help our elderly and frail population in Florida?
Absolutely. Thank you so much for the question. Thank you for having me here. Look, unfortunately, the state of the economy is not doing that well, like we all know. Florida has been hit with massive shortfalls in our budget. We've had to cut across the board without raising taxes. Now, when we look at the nursing homes, I'll tell you that the cut that we all received is less than what the proposal cut was. There was negotiations between the House and the Senate that were going on. Remember, the Senate, as a matter of fact, the House was proposing deeper cuts than the Senate was. This was a negotiated, compromised number that we got to, and I think the Senate stood strong on trying to make sure that seniors are protected. We understood, and our chairman of the Health Appropriations Committee, Joe Negron, understood and understands that we need to protect the most frail and the most vulnerable. And amongst that group is our senior citizens. And amongst those are those especially that are in nursing homes that can't fend for themselves. So I guess I say all that to tell you that yes, I have fought tirelessly to protect the industry, only because I understand and I hope the industry will be there when I get to that point. God willing, I'll get to that point one day. But I know my parents are getting older, and we're living in a society where it's not like it was 20, 30, 40 years ago, where parents were staying at home with their children. Children are working 2 and 3 jobs. They just don't have the time, unfortunately, because they have to work. And we need to make sure we have facilities out there, like you're all, to make sure that we have a place that will take care of our seniors. So yes, I will fight and I will protect the industry to try to restore the cuts. I'll tell you that I won't be able to vote for any piece of legislation this year, any appropriations bill that will have any more cuts to the nursing home industry. So the answer to that is no, I will not vote for a bill that has that. I think I've made my position clear within the Senate this past session.
Thank you, Senator. My next question really concerns nursing home regulations. As you know, nursing homes is one of the most highly regulated industries. There's multiple agency oversight, duplicitous reporting requirements, and this really has become very overly burdensome to us as providers. Would you support legislation that would eliminate the duplicative and overburdensome reporting requirements for nursing facilities, should it come up, in the Senate this year?
It's funny, she asked me these questions. I feel like they're softball questions because I'm always on the side. I've always been supportive of the industry. Absolutely. Look, I think one of the biggest problems that we have in government right now is the overregulation of industries. If you want to foster a good business environment, let's take the nursing homes out of this for a minute. If you want to foster a good business environment, we want to have an environment where we have people coming in and starting businesses. If it's starting a nursing home, that creates jobs, creates employment. The first thing that we need to look at is the overregulation of the industries. And I think Governor Rick Scott has made it very clear that he wants to look at all regulations across the state to try to limit the duplicative regulations that we have out there. You know, it frustrates me when you have multiple agencies coming in and looking at the same exact things that other agencies are looking at. Why not set up a system, or maybe if it's ACA comes in and has a checklist, and if DCF is going to come in, or DOH is going to come in, or another agency is going to come in, just look and see what ACA did, and just have ACA share the information across the agencies. What happens is that the agencies right now aren't talking to each other. And that is something that we need to make sure we address clearly. I think there was a bill introduced, I think in the next year there will be a bill introduced from the Department of Health and ACA, which I will be carrying, and one of the issues that we're going to try to link is a sharing of information between the agencies. I don't know where that will end up, but I think it's important that all agencies, not only the Department of Health, but all agencies across the state, from DCF to the Department of Corrections, everyone should be talking to each other, and maybe set up some type of database where different agencies can come in and cross-reference what other agencies have done. So we don't, and it saves the state a lot of money. It helps you all because you don't have to be worried about DOH and ACA and DCF and all these people coming in, but it saves the state money from resources and people having to go out.
And we all know that's the bottom line.
Absolutely, especially in this time.
Yes, it is.
The times that we're living in now.
Yes, it is. Lastly, just a quick question. As we know, billions of dollars every year are consumed on medical malpractice awards. And in Florida, this has been a tremendous deterrent for business development. And nursing homes are historically a major target for malpractice lawsuits. 2011 legislative session resulted in tort reform passing through the House, but it did not pass in the Senate. If it's reintroduced in 2012, would you support tort reform? Would you encourage your colleagues to support and pass caps on damages, as many of the other states have done in recent years? Absolutely.
We there was during the Medicaid bill, there was some tort reform that was done during the Medicaid reform bill, but it didn't go far enough. I think that we all know that the trial bar looks at the nursing homes as deep pockets. God forbid, I'm all for going after those incidents and nursing homes that are not taking care of their seniors. I'm all for that, making sure that they do have access to the courts. But now, when we start going and penalizing nursing homes, just because they have the deep pockets, we do need some tort reform. I think it's been outrageous what has happened the last couple of years in reference to the industry. And yes, I will encourage my colleagues to vote yes on any tort reform bill that will be introduced, and it will come before my committee. And last year, Ellen Bogdanoff carried the bill, and unfortunately, we just couldn't get it through. The bill was postponed because there was other negotiations that were going on. But now my committee's a lot smaller than it was last year, so it might be a little bit easier this year to get it done. So absolutely yes, I will support and help try to get tort reform done.
Wonderful. Thank you. Bob, I know that you and Senator Garcia have a very special relationship here in the community in Hialeah Gardens and have been friends for many years. Are there any questions that you would specifically like to ask of the Senator?
Certainly, yes. Senator, thank you for being here.
Thank you, Bob.
Building. You've always been a part of my building, ever since we know each other. You're always welcome here. Aside from the looming changes that Kathy had mentioned about the cuts, our wars is into Medicaid getting into managed care. And managed care, definitely, I know where I live in Broward County, they had a pilot project there, and they had not shown any benefits or advantage of managed care as they piloted in Broward County. I know of another representative, Nan Rice, who I spoke with, Nan Rich, and very nicely said, Bob, yes, we love managed care, but that's not the way to run it, in the state of Florida. Now, the whole state will be under managed care, under Medicaid, and you and I know about how managed care are. That it's a great concept, but, the reimbursement, again, the funding mechanism of managed care definitely will take effect. When it takes effect, it's another blow in 2013. We already have these cuts. We would love to manage it better, you know, since we love the concept. We have managed care residents in our building, either with Leon Medical Center right now or here. The Humanas of the world, they're great companies, but we're just worried about, you know, another looming change as far as reimbursement will come.
Bob, you should be worried, but I'll tell you, I wish I can give you an easy answer to that one. I wasn't a big fan of the managed care component for the elder long-term care of the managed care, the Medicaid reform, but our colleagues felt that that was a way to help manage the cost and contain the cost of nursing homes. But I'll tell you that, you know, they're looking at the Arizona model. I think in Arizona it's been implemented for a handful of years. We're looking at other states and see what they're doing. We pushed it back to 2013 for that same reason. I think it's first they need to implement the primary care component of it, the acute care component of it, before we go into long-term care. That's where the industry itself, we're going to have to look to the industry now to see how we can make it work and manage it. You know, I'm sure there'll be risk-adjusted rates depending on the severity of the person in the nursing home or their case. There's a lot of different things that we can look at to try to help with the reimbursements of from the managed care to the nursing homes. But it'll be, you know, there's a lot of, it's a moving target right now, and they don't have the definite answer on that. I don't think I have the definite answer on how the managed care Medicaid is going to work in the state. That's why we wanted to protect our elders, our seniors first by implementing the acute care component of it first before going into long term. So we'll just have to, we'll be talking. I'm sure we'll be talking, having conversations, but we need to be engaged and making sure that our voices are heard.
Well, Senator, thank you for being here today.